Hello, my name is Ken. I'm a student nurse practitioner from Mass College of Pharmacy. I'm going to be doing your physical today. It'll be a head-to-toe assessment. Before I start, can I have your name?
James Matuzik,
Awesome. And what day are we on today?
Saturday, July 29,
Okay, and what city are we in?
Providence, Rhode Island,
What street are we on?
Elmwood Avenue.
Awesome, awake, alert, and oriented, and able to follow commands. I love it. I am just doing a mental health status assessment as I'm doing this with you. I'm just going to be gauging your responses and your behaviors throughout the course of the assessment. Before I get started, can I see your hands? I'm also going to be looking at your skin during this assessment. I'm just looking at your nails, just looking also for lesions. I'm going to be doing that throughout the course of this assessment, just so you know. So to get started, I'm just going to have a quick look around your scalp. I'm going to look around your face. Everything seems symmetrical. You have a little bit of seborrheic keratoses on your head, but I knew about that. Just feeling around your scalp, everything seems symmetrical. Your hair is a little coarse and gray, but I kind of expected that. But ears, eyes, nose, and everything seems to be in symmetry. Okay, so to get started, I'm going to be doing a cranial nerve assessment on you. This part is dull, this part is sharp. I just want you to tell me if I'm touching you, okay?
Yes, 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 yes.
Okay, and I married it up a little bit, but that tests the trigeminal nerve sensory branch, which is cranial nerve 5. And do me a favor, why don't you clench your jaws nice and tight for me? Awesome and awesome. Your masseter and your temporal muscles are nice and tight. And do me a favor, open your jaw and don't let me close it. Awesome, and I cannot close it, so you have good strength. And that tests cranial nerve 5 also, which is the trigeminal nerve. And do me a favor, open and close your jaw for me, and close it. And no popping. I'm not just looking for TMJ or anything like that, popping or anything like that. Now I'm going to test your facial nerve. I want you to do here and smile, which cranial nerve 7. Smile for me. Frown. Puff out your lips. Awesome. And look up at the ceiling for me. And you have symmetrical raise of the eyebrows. And close your eyes for me. And do not let me open them. Awesome. This tests cranial nerve 7, which is the facial nerve. And stick out your tongue like you're being like, It's symmetrical, and that tests cranial nerve 12, which is the hypoglossal nerve, which is intact in your case. Next thing I'm going to be doing is I'm going to be doing a quick eye exam on you. Now, I want you to cover one eye for me. I'm going to stand a little bit far apart from you. Can you read this bottom line?
LTF PH.
Awesome. Your 20/20 in your right eye, and cover your left eye, or your right eye, and read that line for me.
LTF PH.
Awesome. I do it front to back or back in some cases, but your visual acuity is 20/20. This tests cranial nerve 2, which is the optic nerve. All right, and the next thing I'm going to be doing is I'm going to grab my pen light, and I'm going to have a quick look at your pupils, and I'm trying to look in the light. And they're constricting equally and consensually. This tests cranial nerve 2, which is the optic nerve, and cranial nerve 3, which is the ocular motor, which appear to be intact in your case. Next thing I'm going to do is I'm going to follow my finger with your eyes. Awesome. And I was testing your extraocular movements, which test cranial nerve 3, the ocular motor nerve, cranial nerve 4, which is the trochlear nerve, and cranial nerve 6, which is the abducens, which are all intact. And you also have an accommodation response, which is also intact, which is expected. I'm going to have a quick look around your eyes, by the way. I feel around your tear ducts or your lacrimal apparatus. Any pain when I press there?
No.
Awesome. And I'm just going to look in your conjunctiva and sclera. Your sclera is white, your conjunctiva is pink. Eyelids and eyelashes are in correct position, and I'm looking at your palpebral fissures and everything. Everything seems to be intact just on visual inspection. Perfect. I'm going to do an ophthalmic exam. Normally I would turn the lights off, but because we're on camera, I can't. I'm going to be focused on a green bag in the background, and I'm going to come in at an angle. You can see nice sharp margins. I can also see arterioles and veins, and look into my light for me. Perfect. And your eye pupil constricted, but if your pupil was dilated or the lights were off, you'll see your macula area. I'm going to come in on this side too. Following the red reflex in, you can see nice sharp margins. See some arterioles and veins. And look into my light for me. Perfect. All right. So everything else seems to be intact for the eye exam. And next thing I'm going to be doing is I'm going to be doing a hearing test on you. I'm going to cover your ear. I'm going to whisper 3 words into your ear, and I want you to tell me what it is. Apple 36.
Apple 36.
Awesome. And I'm going to try this side.
37 2N.
Perfect. And this tests your hearing, which is innervated by cranial nerve 8, which is the vestibulocochlear nerve. Awesome. So the next thing I'm gonna do is I'm gonna do a specialized test on you. This is called the Weber test. I'm gonna put it on your head, and when you tell me you can hear it on the midline or if you hear it best on the front or the right or the left, okay? Where do you hear it the best?
On the center.
Center? Okay. Next thing I'm gonna do is I'm gonna put it to the side of your ear. I want you to tell me when you can hear it and tell me when the sound goes away.
Sound, I can hear it.
Yep.
It goes away.
Can you hear that?
Yes.
Perfect. Air conduction is greater than bone conduction on this side. I have a bum knee.
I can hear it. It goes away.
You know that?
Yes.
Okay. You have a little bit, I noticed you have a little bit of delay on this side, like as far as your hearing loss on that side. But nonetheless, air conduction is still better than bone conduction, which is negative for Renee's test. Okay. And I'm just going to have a quick look at your ears. I'm just going to palpate around. Any pain when I press on your tragus or any or this area?
No.
Any pain when I press right here?
No.
I'm just going to inspect it on this side. Not seeing anything immediate. Looks like a foreign body, which is awesome. And I'm going to have a quick look at your ear canal. I'm going to use my otoscope. I'm going to pull up and back. You have a little bit of wax in the external canal, by the way. But you have a nice pearly membrane, tympanic membrane, and you have a 5 o'clock light reflex on your right side. I'm just going to check on this side. No evidence of effusion or anything like that. And you can see a lot of wax on this side. Well, yeah. Am I hurting you in any way, shape, or form?
You're good.
You have actually a little bit of wax and blood on this side, too. Huh. Well, I need a cleaning on that side, but your tympanic membrane, you have a 7 o'clock light reflex, and your tympanic membrane's intact. Use Q-tips, right?
Yes.
Yeah, you don't want to go any further than your ear, because then you can actually damage your inner ear canal in that case. Awesome. And, all right, so that concludes for the ear exam. Next thing I'm going to be doing is I'm going to have a quick look at your nose. I'm going to use this nasal speculum, but before I do that, I am going to have you just tip your nose up like that, and I'm going to press here. Take a deep breath in. Awesome. And this side. And your nares are nice and patent. I'm just having also a look around your nose. I'm just going to palpate. Any pain when I press on your sinuses,
No.
by the way?
No.
Awesome. And I'm going to present you with 2 smells, by the way. I am going to have you close your eyes, cover one nostril for me, and have a smell. Just tell me what this is.
It's coffee.
Awesome. And cover another nostril, the other nostril, and tell me what you smell now.
It's rubbing alcohol.
Awesome. So that tests oral olfactory nerve, which is cranial nerve 1, which is intact in this case. Awesome. And one other thing I am going to be doing with you is I am just going to have a quick look at your septum. And I'm going to grab the nasal speculum and my pen light, and I am going to just have a quick look in your nostrils. I know you have a little bit of hair in there, but it's nice and pink. Your turbinates are visible. It's nice and pink in there, though. I'm not seeing any evidence of septal damage. Same on this side, mucosa and everything seems to be intact. Awesome. All right, so everything looks good with your nose, and I'm going to move on to your mouth. This is just a tongue depressor, and I'm going to look at your lips. Everything seems to be intact. And I want you to open your mouth and say, ah. Okay. Your uvula rose, by the way, your soft palate rose. I'm just going to also have a look inside. This also tests cranial nerve 9, which is the glossopharyngeal, and cranial nerve 10, which is the vagus nerve when you did that. I'm just going to have a quick look around. Yeah, quite a bit of dental work I can see. And you do have some partials that are kind of still they're coming out, but your mucosa is nice and pink. Full fillings, cha-ching, all right. But everything seems to be intact. And your tonsils aren't visible. I think you had tonsillectomy, correct?
Yes.
All right, that explains it. All right, so everything's looking good otherwise. And I'm going to just test your ability to swallow for me. I want you to have a quick sip of water. Any trouble swallowing?
No.
I noticed that your phonation is okay and your swallowing is okay. This tests cranial nerve 9, the glossopharyngeal nerve, and cranial nerve 10, which is the vagus nerve, as well as cranial nerve 12, which is the hypoglossal nerve. You need those intact to be able to swallow. Perfect. I'm going to do a favor. I'm going to put your hands on your shoulders. Shrug your shoulders for me. All right. You have good strength bilaterally, and I'm going to turn your head, and I want you to press up and resist me while I'm doing that. Awesome. And do it on the other side. Resist. Awesome. This tests the spinal accessory muscle, which is cranial nerve 11, which is intact in your case. And I'm going to stick your neck like that for me, and I'm just going to feel right here. Your trachea is nice and midline, and I'm palpating your thyroid. it is not really palpable. I'm gonna have you have a sip of water. I'm gonna do that, and I'm gonna have you. I'm gonna palpate your thyroid as you do that. And it's not palpable as you swallow. All right, perfect. All right, so the next thing we're going to be doing is we're going to be doing your cardiopulmonary assessment, but I'm also going to do your lymph nodes as well. So real quick, before I get started, I'm just going to feel around your lymph nodes. I'm feeling your preauricular nodes, your postauricular nodes. I'm doing your tonsillier nodes right here, your submental nodes, your sublingual nodes, and they're not palpable. I'm doing your posterior cervical nodes, and I'm doing your superficial cervical nodes. And I'm going to be doing your deep cervical nodes, which I'm going to press in for those. I can't feel them. I'm also going to be doing your supraclavicular nodes and your infraclavicular nodes. And I can't feel any of them, so that's a normal finding. All right. So the next thing I'm going to be doing is I'm also going to have a quick look at your axillary nodes. You can hold out your arms like that for me. And I'm going to palpate in. I'm pulling in towards your chest. This is your pectoral nodes. I cannot feel them. I'm going to press in deep here in your armpit. And that's your central axillary node. I'm going to come around from behind you, and I'm going to palpate in behind your subscapular nodes. I cannot feel them. And I'm going to also feel around your lateral nodes. Hold your arms here one more time for me. Thank you. Lateral nodes are not palpable. I'm going to flex your arm like you're Superman. Awesome. And I'm feeling around your epitrochlear nodes on this side, not palpable. And flex your arm, and your epitrochlear nodes are not palpable. Awesome. So I'm going to be doing part of your respiration for the purpose of camera. I'm going to have you stand up and face the camera, face your back towards the camera. Perfect. So I'm just looking at your chest right now. I notice you have some seborrheic keratoses on your back, by the way, but I notice that you have good muscle mass and that your chest is expanding. I'm not seeing any use of accessory muscles. And I'm going to get started. I'm going to actually just percuss down your back and down your spine. It's generally resonant. I'm not hearing any unusual notes as I'm doing that. And I'm also just going to palpate around your spine and palpate around your scapula and palpate around your posterior lung fields. I'm just looking for any chest wall deformities or anything like that, which I'm not feeling, which is a good thing. And I'm also going to have you do me a favor. I want you to take a deep breath in for me and out. Awesome. So your chest wall excursion is about 2 centimeters bilaterally, so that's expected. And any pain when I press here on this costovertebral angle?
No.
Awesome. Any pain when I percuss right there?
No.
Awesome. So there's no costovertebral tenderness. And I'm going to do me a favor. I'm going to touch your back, and I want you to say 99 for me, okay?
99.
Okay.
99. 99. 99. 99.
Awesome. I didn't feel any hyperresonance when I was doing that for the tactile fremitus. I'm going to also listen to your lung sounds from behind. Take a deep breath out through your mouth. Awesome. Great. Good. All right, and it's clear to auscultate bilaterally as I did that. Awesome. Now for the next part of the assessment, can I have you sit on the bed for me? Can I have you lay down? And I'm going to pull this up just so you're comfortable. I know why you're jutting your leg out like that all day. And I'm going to actually undrape you from the front. And keep your abdomen covered just so you don't get cold or anything. All right. And I'm just looking at your chest. I'm noticing that it's very well developed. You have pretty good pecs. You doing push-ups?
Sometimes.
Yeah, I noticed. And I'm also just going to press in. I'm just feeling around just to see if there's any issue with your chest wall. You have a little seborrheic keratosis and acne on your chest. And I'm not noticing anything unusual with the chest wall. Awesome. And I'm also just going to percuss. And it's resonant throughout, which is an expected finding. And I'm going to put my hand on you. I'm just going to say 99 for me.
99. 99. 99. 99. 99.
Okay. And yeah, I didn't notice any unusual movements in your chest wall as you did that. If I did, or any vibration on that, I would check for what's called bronchophony. I'd have him say 99 with my stethoscope listening, and if I heard it very clearly, that'd be an evidence of lung consolidation. I could also use egophony, which involves him saying E, 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 and then changing over to an ah sound. And then whisper pectorally, where I'd have him whisper 1, 2, 3 repeatedly. And if it changed to be something suddenly clear, it'd be evidence of lung consolidation, which could be evidence of pneumonia or masses. Okay. And the next thing I'm gonna be doing with you is I'm gonna have a quick listen to your lung sounds from the front side. Do a deep breath in and out for me. Great. It's clear to auscultate bilaterally, just so you're comfortable, by the way. One thing that I can say is, like, if there was unusual lung sounds, that we would hear something like ralease or crackles. If you hear ralease, it kind of sounds like cellophane popping, and that could be a sign of peripheral lung field, fluid in the peripheral lung field. It kind of sounds like cellophane. Another adverse sound would be bronchitis, like a snoring sound, which you would hear when you have an exudate, or if you have like a lot of gunk in the lungs, especially the bronchioles or the bronchi. And then the other one we listen to is sounds like wheezing, which is kind of like a high-pitched sound on expiration, like sound, which is evidence of something like asthma, or when people are breathing out, especially more noticeable on expiration, which I'm not hearing in your case. Okay. And the next thing we're doing is I'm going to do a cardiac assessment on you. And by the way, I'm just going to put my hand on your chest. And I'm just feeling for any palpable thrills, any heaves, any lifts, and you're not cyanotic or anything that I can see. And I'm also feeling for point of maximum impulse with you, which is fifth intercostal space. It's right in the mid-clavicular line, slightly more medially, and it's about 2.5 centimeters. Okay, I can feel it right there. All right, and I'm going to have a quick listen to your heart sounds. I am going to be doing some special maneuvers with you for the heart, just a fair heads up. And I'm listening right here at the aortic point, right next to the angle of Louis. I'm going to your pulmonic. I'm using the diaphragm. I'm going to inch it down into Erb's point, and then to the mitral valve, also the PMI. I'm going to switch over to the bell. I'm going to have you just lean over to the left side for me, just slightly, just like that. It's fine. I'm supporting you. All right, and that's the mitral valve maneuver. I'm not hearing anything unusual there. You can hear your head back and relax. And I'm just going to go back up. We're using the diaphragm the way it came to Erb's point. Into the pulmonic valve. And then right over the aortic. And by the way, I am going to do one special maneuver with you. Now you sit up for me and lean forward. I'm going to use the bell of my stethoscope for this. I want you to exhale and hold your breath on the exhalation. And hold your breath. And I'm not hearing any murmurs. All right, I'm going to put you back down. I'm just doing that also, just listen for a special maneuver for aortic sounds. Okay. Now, next thing we're going to be doing is I'm going to also just have a quick look and feel for your pulses. I'm going to feel your carotid pulse. I'm going to take my pen light, by the way. I'm going to hold it at kind of an odd angle. I'm going to use this little ruler here and a straight edge. And you're about 1 centimeter for jugular venous distension, by the way, which is normal. Plus there's 5 centimeters, so it's about 6 centimeters total from your right atrium, which is a normal finding. Awesome. All right, and the next thing I'm going to do is I am just going to have a quick listen to your carotid arteries while I'm looking at your neck. Can you do a favor? Take a deep breath in, hold your breath. Awesome. Other side. And I'm not hearing any bruise in the carotid arteries, which is normal, it was expected finding. Alrighty, and now I'm just going to, and by the way, your 2+ pulses for your carotid arteries bilaterally. I'm going to feel your other pulses, by the way. That's your brachial pulse. It's 2+, and your radial pulse, and your ulnar pulse as well. Those are all 2 plus, looking good. I'm just gonna move this up a little bit. I'll put my hand right on your thigh area. I can feel your femoral pulse, that's also 2 plus. And I'm gonna feel right here behind your knee. Popliteal, 2 plus on this side. Popliteal's 2 plus. And I'm also looking for edema here. There is no edema. There's no edema on this side. And any cyanosis or anything, nothing on that side. And I'm going your posterior tibial pulse. This is 2 plus. And your dorsalis pulse, just 2 plus. Any pain when I press in your calves, by the way?
No.
Okay. That's what we look for deep vein thromboses, by the way. Awesome. So I noticed there was nothing unusual in this part of the assessment findings. Okay. So I'm gonna actually help you slip back into this, just to reposition you. And I'm gonna be doing your abdominal assessment. This will also keep you warm because it's freezing in here. I'm gonna help you scooch up in the bed a little bit because this will probably make you a little bit more comfortable. Here, okay. Can you scooch up back in the bed for me? Yeah, I got you. Just so it's a little easier. There we go. And I'm gonna ungrate you on this side to do your abdominal assessment. Now, looking at your abdomen, I noticed that you have quite a few scars, by the way. Just looking at it, you have a transverse scar that you mentioned was from a colectomy about 30 years ago. You have a scar from a hernia repair, which is going down vertically. And you also have a peg tube scar and some seborrheic keratoses, which we knew about. Now, I'm gonna get started. I'm gonna have a quick listen to your abdomen. And I'm going for your right lower quadrant. I'm gonna use the diaphragm. Hear good vowel sounds. I'm going up in clockwise fashion. Okay, all your vowel sounds are there. And by the way, take a deep breath out through your mouth for me. And out. And on this side too, in. And out. All right, and by doing that, I'm looking for hepatosplenic friction rub, and I'm not hearing any liver or spleen friction rub. I'm gonna switch over to my bell, and I'm gonna have a listen to your aortic artery. You can hear the pulse, but no bruit. And your renal arteries. Your iliac arteries. And I'm just gonna pull this right into your pant. And that's your femoral artery. And your femoral artery, I can't hear any bruits. Great. Now I'm just gonna have a quick, I'm gonna percuss over your abdomen. It's tympanic, by the way, which is normal. And I'm just gonna percuss right over your liver. And I'm just gonna get a quick measurement, by the way. Wherever I lift my tape. Ooh. There we go. So your liver is about 9 centimeters altogether. That's for total liver span. And I'm also going to percuss over your spleen on your left side. And it's tympanic in the splenic space. Can you take a deep breath in for me? All right, and it's still tympanic even when you inhaled in. Perfect. So the next thing I'll be doing is I'm just going to be palpating, and I'm going to do a light palpation first. Any pain when I'm pressing in very lightly?
No.
Okay. I'm going to do a deep palpation. Let me know if I'm hurting you in any way,
No.
shape, or form.
No.
Okay.
No. No.
Awesome. And I'm also going to be pressing up, and I'm going to come up at an angle. Actually, I'll come through, use a hooking technique. And I can feel your liver's edge. It's about 1 centimeter past your costal margin. It is palpable. And I'm going to come up at a little bit of an angle. I'm going to come up towards your spleen. And deep breath in and out for me. And your spleen is not palpable. Awesome. I'm also going to feel your kidneys. And if you're uncomfortable, I can raise your, I can put your legs up a little bit. There, it's a little bit easier. I'm just ballotting your kidneys. I cannot feel them. All right, and I can't feel your kidneys. Perfect. All right, so the next thing we're going to be doing, just for a quick thing for your abdominal assessment, is I'm just going to be palpating for your aortic pulsations. It's midline, a little bit to the left. It's very subtle, but it's less than 2 centimeters, so I'm not too worried about that. Now I'm going to be putting my hand on your groin area, just below your inguinal ligament. I'm feeling for your horizontal lymph nodes. And I'm going to your medial thigh for your lateral lymph nodes, which I cannot palpate in this case. Awesome. Here, I'll get that down for you. All right. So that concludes at least the portion of the abdominal exam. Here you go. I'm going to pull this out for you. I'm going to have you sit at the edge of the bed. We're going to be doing a neurological exam part next. So as far as it goes, thus far your mental status, you've been awake, alert, and oriented, and you've already proven that to me. So I'm going to be doing just a few quick neuro tests on you. I'm going to have you hold out your arms like this. I want you to touch your hand to your nose. Perfect. Awesome. And I want you to put your hand to your nose and then to my finger. And keep doing that. Awesome. And switch hands for me. All right, that seems to be intact on that end. And do me a favor, put your hands, and I want you to touch your finger, your thumb to each finger for me. You do seem to have a little bit of trouble doing that, but I also know you're not the best with coordination. You're actually not terrible. You're good. So I want you to put your hands on your left, and with your left hand, I want you to move it like this and try to turn it upside down faster. And your right hand, opposite way. Both hands for me. Awesome. So the next thing we're going to be doing is I'm going to just test your sensation. This is sharp as earlier, and this is dull. Let me close your eyes for me. And I'm going to touch you with it, and I want you to, I'm just your hands and your feet. Let me know when I'm touching you, okay?
Yes. 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 Yes.
And I'm varying it
Yes.
too.
Yes. 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 Yes.
All right. And your hands and your upper extremity seem to be okay. I'm going to do your feet too. Close your eyes for me.
Yes. 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 Yes.
Feel that?
Yes. Yes. Yes.
And do the bottom of your feet too.
Yes.
Awesome.
Yes. 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 Yes.
Okay. So light and dull touch sensation seems to be intact for that part of the assessment. Awesome. This is just a tuning fork. I am going to put it and just test your vibrational senses, by the way. I'm going to take it to your wrist. You can just feel it. You feel it vibrating?
Yes, I do.
All right. Can you feel that okay?
Yes.
Feel that okay?
Yes.
Awesome. Do your opposite side.
Yes.
Other side. Perfect.
Yes. Yes.
Okay. And I'm going to do it to your big toe too. By looking at your big toe, it looks like you have a little bit of fungus growth there.
Yes.
Yep. You feel that okay?
Yes.
Awesome. And do your ankle.
Yes. Yes. Yes.
Awesome. So your sense of vibrations is intact. All right. Next thing I'm gonna do is I'm gonna do a special test with you. It's called stereognosis. I'm gonna close your eyes for me. Hold out your hands. I'm gonna put an object in your hand. I want you to tell me what it is.
It's a coin.
Okay. And I'm gonna have you take another object in this hand. Tell me what it is.
It's a small. Feels like a smaller coin.
All right. Perfect. So your size discrimination and your ability, your stereognosis. Okay. All right. You're all set. You can open your eyes. Now, for the next test, I'm going to be taking the sharp point and I'm going to be drawing a number on your hand. I want you to tell me what that number is, okay? Close your eyes.
3.
Mm-hmm.
3.
Awesome. And do this one for me.
8.
Yep. Whoop, it broke off.
8.
8. Awesome. So that it tests graphesthesia, or your body, or your ability to sense objects that are being drawn on you, or if I'm drawing an object on you. So that's intact. So the next thing we're doing is I'm going to be testing your deep tendon reflexes, by the way. And for this, I'm going to just get my percussion hammer out. And I'm going to just be hitting you. Just have your hands out nice loosey-goosey for me. Okay, there's 2 plus brachioradialis. 2 plus brachioradialis. I'm going to take your brachial. Okay, you got 2 plus. A good contraction right there. 2 plus, good contraction. And I'm gonna have you let your arm hang loosey-goosey for me. You have kind of a diminished one on this side. It's about 1+. It's there, but it's a little more diminished. Relax your arm for me. And it's about 1+ on this side. Again, a little bit diminished. And I'm also going to do your DTR right here on your patella. All right, nice and 2+ on that side. 2+ on that side, perfect. And I'm going to also do your Achilles reflex. I'm going to relax your foot for me. I'm just going to move it up and down, just loosen it up. All right, you have a 2+ on that side, which is palpable. All right, 2+ on that side. I'm also going to do a Babinski reflex on you. And I didn't see any upward fanning or anything like that. It's negative. I'm going to do it on this side too. And you have a downward fan, a downward curling, but nothing upward. So that's normal. So your Babinski reflex is negative. Perfect. All right. So I'm going to be doing just a few quick motor exams on you, by the way, but I'm going to have you close your eyes. And I want you to tell me if your toe's going up or down, okay?
Down, up, down, up, down, down.
Awesome. So your proprioception's okay. Can you do me a favor and tap your left foot against mine? And tap your right foot against my hand? And both feet? Awesome. Nice and symmetrical. Perfect. So for your next part of the neuro assessment, I'm going to have you stand up, actually. And what I'm going to do, just to make sure that we keep you straight, is I'm going to be having you just do a quick exercise. I'm going to put your feet together for me. And I want you to look straight forward for me and close your eyes. And you have no sway. It's a negative Romberg's test. And I'm going to have you hold out your arms like that for me. And close your eyes. And you have no pronator drift. You're okay. You're almost at it. Next thing I'm going to have you do is I'm going to have you, if you can, I'm going to have you walk in that direction heel to toe for me. And take your time. This is not a race. Go ahead. Come towards me. This one's not easy for you to do, is it? Okay.
No.
We can stop it. I don't want you to risk a fall. And one thing I'm going to have you do is I'm going to have you, if you can, stand on one foot for me. And close your eyes. You can't really do that. I know you have some balance problems. Can you do it on the opposite foot? Try that on the other side. All right. You have a little easier time on that foot. I noticed that. Okay. And can you hop on that good foot for me? Awesome. And can you hop on the other one? All right. But you have some hard time with your balance. I did notice that, by the way. But your gait when you're walking is steady, and I did notice that as you walked in for the assessment, by the way, before we started filming. And the next thing I'm going to have you do for me is, I just want to have a quick look, by the way. Okay, and I want you to try to bend at your knees like that for me as best as you can. Is that as far as you can go?
That's the best I can
All right,
do.
you're good. Your deep knee bend is okay. All right, I'm going to have you have a seat again. We're going to do a quick musculoskeletal assessment on you. So for this exam, I'm just going to be having a quick look and doing a quick few range of motion of your head and neck. I'm going to have you flex your neck down for me. That's flexion of the neck, and extend your neck. All right, and I want you to turn your head side to side for me. And that's a rotational movement. Awesome. And what I would like you to do is touch your head to your ear. Other side. You do have some limited range of motion, I noticed on that. All right, and that's lateral bending. All right, and for this end, just in case you do have any gait instability, I'm gonna have you stand up for me. And we're gonna have you, I'm gonna have you bend down for me, flex down at the back. And I'm palpating down your spine. I'm just noticing that you're bending down when you're your flexion of the spine. There's no evidence of scoliosis or lateral curving. You do have a little kyphosis right here that I noticed, but that's something that does happen with us as you get older. All right, so next thing I'm going to have you do is I'm going to have you do this. I'm going to bend at your side, and that's lateral bending. And it is a little bit more limited. I did notice that that is a limited mobility. And can you twist or do a rotational force at your spine? Okay. Okay, so your rotational momentum in your spine is intact. All right. So I'm going to have you, I'm going to come around from behind you here, and I'm just going to palpate, and I'm looking at your joints. I'm going to start at your neck. I'm just feeling for any crepitus, any warmth, any heat. And I'm also going to be palpating right here on your shoulder area. around your acromion, your coracoid process, around your scapula, feeling for any warmth, any tenderness, in any crepitus or anything like that. I'm doing the same on this side too. And you would feel crepitus if there was something like a rotator cuff injury, but I'm not feeling that today. Okay. And I'm also going to go down here. I'm going to lift up the drape a little bit. Hold that for me. Thank you. I'm going to feel right around your hip. The hip you can't directly palpate, but I'm feeling around the anterior iliac spine. And I'm feeling around the greater trochanter. Not feeling any warmth or anything like that. I'm also going to feel your sacroiliac joint. And that's on the behind side and the posterior iliac spine. All right, no warmth or anything like that, and no pain or anything when I'm touching you? Okay. All right, and I'm gonna have a look at your knees. Can you sit up on the bed for me? There's a little step there. Thank you. Okay, so the next thing I'm gonna do is I'm just gonna have a palpate your knee joint. I'm feeling around and also looking for any fluid or any evidence of inflammation, any heat, warmth, tenderness, anything like that. And there's no evidence of fluid. Perfect. And I feel around your ankle too. And nothing like that. I also noticed that there's no nodules or anything on your feet or on your around your elbow area, but I'm going to come around back up there. I'm just feeling around for any nodules or anything like that, or any heat, especially around the big toe, which could be evidence of gout. And I'm going to feel around your elbows next. And I'm feeling around your olecranon process. I'm also feeling the extensor surfaces for any nodules or any warmth or tenderness, which could be evidence of bursitis. And also around the epicondyle area, which is the lateral part of it. Nothing there. I'm going to check the other side too. All right, I can't feel anything there. Awesome. So I'm also going to be doing your wrists too, just feeling around. Not feeling anything there. No nodules, no heat or anything like that. I'm doing the hands as well. I'm not feeling anything as far as your hands. All right, so the next thing I'm going to be doing is I'm going to be just assessing two of your joints, your symmetrical upper extremities. In this case, I'm going to be doing your arms. I'm going to have you do this for me. You flex your muscles in like that for me, and then push out. That's flexion. That is extension. Flexion, extension, and pull me towards you. Ooh, you work out still. And I want you to push towards me. So you have 5+ strength in that, and I also want you to do this. This is called pronation, and that is supination. That is supination's like this, and this is pronation. And switch that movement for me against resistance. You good strength, and again, you have really good strength. Those are the range of motion of the elbow joints as well. And you have 5+ strength, and you also have really good muscle bulk too. By the way, you still work out?
Yes.
Yeah, I believe it. All right, and you have good muscle strength, and it's about equal bilaterally. Perfect. Next thing I'm going to be doing is I'm going to also do your knee. I want you to kick your knee out for me, and that's extension and flex in. In, pull your knee in like that. All right, and you have good strength. All right, and this is extension, and this is flexion. And do me a favor, I want you to rotate your foot towards my hand. All right, and that is actually tibial, and that is an internal rotation of the knee, or tibial internal rotation. And push out with against your towards this hand. All right, and that is external rotation, and you have good strength when you're doing that. And do it on this side too, external, and then internal towards me. All right, and again, and push in towards me. And you have 5+ strength, so your strength in that end is perfectly fine. Awesome. So next few things I'm going to have you do, by the way, because I probably forgot to do this earlier, is I'm going to actually put you back on the bed. I'm going to do a few specialized maneuvers for your abdomen and your legs because I do them together because they're similar body parts. I am going to have you relax your leg for me. And any pain when I pull out like this?
No.
All right, that's obturator sign, by the way, which can be evidence of appendicitis, by the way. And if you had pain, that would be producible right here in your lower right quadrant of your abdomen if we did that. Another thing that we should be doing as well is also just doing rebound tenderness where I press in and I let go. Any pain when I did that?
No.
Any pain when I press and or let go?
No.
All right. Any pain when I press and let go, especially here on the left lower quadrant,
No.
and nothing radiated from the right lower quadrant?
No.
That's Roswig's sign, by the way, and further evidence that there would be appendicitis in those cases. And I want you to take a deep breath out, in and out for me. And deep breath in. And there's no hesitation. Any pain when you did that?
No.
That's negative Murphy's sign, which could be evidence of gallbladder inflammation as well. The next thing I'm going to be doing with you is I'm going to be assessing your knee joints. I'm only going to do one joint. Normally we do this bilaterally for demonstration purposes. We're going to do this specialized test with just one joint today. But first, can you just lift up with your left leg for me? Any pain when you're doing that?
No.
Okay. And that's psoas test, by the way. If you had appendicitis, that would put pressure on the peritoneum around the appendix as well. So I'm going to do this. I'm going to internally rotate your hip, electrolyte leg for me, and I'm going to internally rotate the hip and externally rotate the foot, and I'm going to bend down. Any popping or any pain when I'm doing that?
No.
Okay. And that's McMurray's test. That tests for lateral and medial. Medial meniscus tears. And I'm also going to do the opposite side. I'm also going to externally rotate the hip, and I'm going to do the same test with an externally rotated foot. And there's no popping upon extension. You do, I notice, have some weak range of motion as well in your knee, but I also know you have a history of arthritis as well. So the next thing I'm going to be doing with you is I'm going to be doing a check for your knee. I'm going to have you bend your knee up like that for me. I'm going to secure your leg with my foot, and I'm going to pull towards me. And I'm feeling for any instability in the knee joint, and I'm not feeling it. That's called anterior drawer sign. I'm going to push again towards it. And that's the posterior drawer sign. In this case, it's negative. Okay. And I'm also going to have you relax your knee for me. And I'm going to press down here like this. I'm going to kind of milk the knee fluid down. I'm going to press in medially and laterally. I'm not seeing any fluid wave as I'm doing that. That's negative bulge sign as well. Okay. So one last thing, by the way, before I wrap it up with you, is I do want to do a two things, varus valgus stress, plus I just want to see your gait as well. Healed a special type of gait. I'm going to do what's called a varus stress, where I'm putting medial pressure with my left hand, and I'm putting lateral pressure on my left hand, medial pressure on my right. And this tests for lateral collateral ligament tear. I'm not feeling any pain when I'm doing that, and you don't have any joint instability as I'm doing that either. I'm doing the opposite. That's called valgus stress, and I'm not feeling anything, which tests your medial collateral ligament. So that's a good job. Just for your decency, by the way.
Thank you.
All right, so that seems to be intact otherwise. And all right, so the next thing I'm going to do with you is I am going to have you do a quick walking test. I'm going to have you walk on your, here you go.
Thank you.
And I'm going to have you walk on your tiptoes towards the wall that way, and then back towards me. Come towards me. Awesome. All right, and can you walk on from your heel on your heels? And you turn around when you do this. I don't want you to run out of space. I'm noticing though that your gait is steady as you're doing this as well. This tests musculoskeletal and neurological systems, dorsiflexion, plantar flexion. Awesome. And one last thing, I'm gonna have you just lay down one last time for me. I'm gonna have a quick measurement of your. I'm just going to measure your leg, and I'm feeling from the anterior superior iliac spine to lateral malleolus. And you are about 78 centimeters on this side. And I'm going to feel right here, anterior superior iliac spine, and you're about 78 inches on that side. Awesome, so it's symmetrical in length. All right, James, thank you so much for your help today.
You're welcome, Doctor.
Not a doctor. You can cut.